Okay, let's do a roll call. And we have a quorum, bring the meeting to a start. Jeff Butler,
Present.
Bob Connington,
No.
John Eagleman,
Yo.
John Lebo,
Yes.
Sabrina Pennington,
Present.
Paul Ryder present, Peter Zaleski.
Present.
Okay, I call the meeting to order. And the first item is approval of the minutes. I think you got copies of the minutes earlier, and then just recently I kind of proofread a copy of the minutes.
Yes, I apologize about that. In my haste to get them to you guys as quickly as I could, I didn't do a good job of going through those and helping to get them condensed and kind of find those errors, but I think that the last one's a pretty good representation.
They were excellent, Christine.
Thank you.
So, is there a motion to approve the minutes?
And this is Engelmann, and I move that they be approved.
Okay, John Eagleman has made the motion. Is there a second?
I'll second John Lebo.
The second was made by
Lebo.
Jeff Butler. Okay.
Do you have?
The motion's been made, and we do a roll call vote. For those in favor of approving the minutes, Jeff Butler.
Aye.
Do you have the other ones that they need to sign?
And Bob Connington hasn't joined us yet. John Eagleman,
Yes, aye.
John Lebo,
Aye.
Sabrina Pennington,
Aye.
Paul Ryder, aye. Peter Zaleski.
Aye.
The motion carries. Health officer report.
Well, to date in the county, we've had 190 cases, 65 clinically positive, and 125 clinical diagnoses. We've had 5 deaths. We have not had a death for 2 weeks. The 40% of the ICU beds and 80% of the ventilators at Reed are available, so we've and it appears like we're on the downward slope of the curve. If you look at the numbers from the state, they've had around 29,000 positives with 1,700 deaths. They tested 200,000 people, and 15% of those have been positive, which means we're not doing enough testing, because most epidemiologists think you have to test enough to drive that positive level down to 10%. The first real meaningful numbers of where we are with this coronavirus came when the state, the ISDH, along with Fairbanks School of Public Health, decided to randomly test citizens in the state of Indiana, and they're doing this in a group of 4 groups of 5,000 people apiece. They set up 68 test sites and tested with this first group 4,600 people, and these people were invited by invitation to be tested. So 1.7% of the people that came in for that testing were positive for COVID, and they also did antibody tests on all the people, so another 1.1% had coronavirus, which means in that study 2.8% of the citizens of Indiana had at the time or had coronavirus. They were able to determine that the death rate was 0.6%, which is much lower than death rates we heard when this epidemic began in January. You remember out of China they were talking 3.5% to 4% mortality, and we'll probably never know the mortality from coronavirus till it's all over, because it's easy to determine the deaths, but because of the scarcity of testing, we don't really have the denominator of that death infected ratio. I think it's interesting, of the people that came in for that testing that were positive, 45% of them had no symptoms. So it shows the importance of social distancing when you're out and about. I think in summation, when I look at the numbers from the state and from Wayne County and from Reed, where there's definitely a downward trend of the curve. And as we, where we go from here, I think is pretty much up to the behavior of our citizens. I think if we continue with social distancing and wearing masks, we'll probably go forward. I think it's inevitable that there's going to be some group gatherings and there's going to be some outbreaks. I hope that they're mini outbreaks and not some horrendous thing in a nursing home or I don't know, a family gathering or a family reunion or a wedding, but that's where we're at present.
Any questions?
What's been the response for the testing that was at Salvation Army, now at,
Was it the Armory?
was at the Armory, now it's at, now it's at the Builderberg, excuse me, yes.
Yeah, it's, I just got an update from Angela McDaniel. She's kind of been the liaison between our department and them. We put up a lot of signage. We purchased and had those hung around there to make it more visible. We took our trailer over there and put a sign, because it was hard to get one hung there, so we pulled the trailer over there and hung the sign on the side of our emergency response trailer. They just reported to Angela every day this week they've had over 50 people a day coming in for testing. Half walk-in, half appointments. So while they don't want to advertise that they take walk-ins, they will accommodate walk-ins as they can. I think there was some frustration on Monday because their nurse didn't show up. And so for the morning, they had no one. They had a lot of people come in and that they had to turn away. That frustrated them. That frustrates the community. But from 1:30 to 7:30, they did over 50 people that day too. So I think that it is being utilized there. I hope that ISDH and Optum will continue to keep it here in Richmond, but I have heard that it's going to be reevaluated at the end of May, and some of these sites are going to be reallocated around the state. I don't know if we'll have it after the end of the month. So I've been encouraging the public. I was on the radio today, if you're returning back to work, you want to make sure that you don't have it as you return back. Go get tested. If you have symptoms, definitely go get tested. If you've been around someone that's been identified as being positive, go get tested. Because once we lose that side, then we get back to the how do we get people tested. This is free. If you have insurance, they'll take your insurance. But if you have no insurance, it is free. If you have insurance, you will not receive a bill. They will take whatever payment the insurance pays for this test. So it couldn't be, unless you got $10 every time you got tested, it couldn't be any better than what we have right now. Downtown Richmond, 601 East Main Street in the old Elder Beerman building.
And Christine and I have been in our morning conferences with Reed Hospital, encouraged them to, many people present at their respiratory clinic there, and we've tried to encourage them, and we've got a conference with that respiratory clinic leadership group to get all those people referred down to this testing site. Because I think they've been telling a lot of the patients, you may have coronavirus, go home and isolate yourself. Well, here we've got a testing site where they can go down and get tested, so I hope that we can utilize that. That'll make our numbers go up, and I want to hang on to this testing site. It's a valuable resource.
Right.
You know, a free testing site in the middle of a pandemic is pretty useful.
Amen.
Well, and as we watch the numbers go up, and we expect that as you do more testing, you will find more cases. It doesn't mean that you're having exponential growth in the community. We understand that when we're looking at numbers. So not only are we looking at the case numbers, we're also looking at how many people are going to the respiratory clinic, how many people are being hospitalized, how many people are on ventilators, when we're looking at what is the true status of Richmond right now. And I believe that we are on a downward trend downward, although our numbers are trending upwards, is because we're doing more testing and we're finding those people with very mild symptoms or asymptomatic carriers of the virus. But as far as hospitalizations and people on respirators, we are trending downward, and that's a good thing. That's all.
As
Any further questions?
I
before we
got
move
one,
on
Paul.
to Christine's report.
I got one. As the restaurants have slowly opened up to in dining, and you've seen some salons start up, have they been calling, asking for anything, or voicing any? Are we getting any calls from those places? All right, with frustrations of certain needs or?
No, we haven't really. We're there for the restaurants. We've been out to a few that aren't following the guidelines. We've received more complaints from the public of people not wearing masks, of their salon not wearing them. I think we've got one on a couple of chiropractors and restaurants. So we go out, we educate, we hope to gain compliance just by education. If a restaurant is not following the guidelines, we have a mechanism to take enforcement. But if it's a situation where it's something that the health department doesn't regulate, we have to call in the Alcohol, Tobacco, and Firearms Division, and they take enforcement. And we have seen them take enforcement. They will pull their license from the state to operate. And so we really try to get people to, through education, gain compliance with that way other than enforcement.
Okay, any more questions? Okay, Christine, you want to go on with
Yep.
Deputy Director report?
Yep. Dr. Ryder or Dr. Jetmore and I interviewed 3 really excellent candidates for the RN position. I would have been happy with any of them. Just really dynamic people that were interviewed, but we did settle on, her name is Tammy Roberts, and she has had some experience in a place in Connorsville that does a lot of STD and counseling of women, and we felt like she would be an excellent fit. Working with the health department and our immunization programs and with our STD clinics. So we offered employment, and she accepted the offer, and we'll start June 1 here. We have some trainings already scheduled. VaxCare will be here June 4th to do onboarding with us. And then I think a week after that, we'll be onboarded with our Anthem EMR. And so we'll go through that training and should be ready to start the vaccination clinic by the end of June. Maybe that 3rd week in June we'll be doing immunizations. I have worked with Kim on from the clinic, Flanagan, working on getting our inventory over here as the June 1 date looms before us. And I told her I expected all of the VFC vaccine to be transferred to the health department, which is per ISDH's guideline. That's the health department's vaccine, so 100% of that vaccine will come to the health department. I'm a little nervous that inventorying and documentation could get, we could get tinged on that if what we receive isn't what ISDH's inventory says that we should have. So that will be a discussion that I have with my vaccine coordinator with ISDH. And then as far as the private stock vaccine goes, I expect 70% of the inventory to come to us. I have no way of knowing what 70% of that inventory is. I have to trust that they will do what's right for the public and give the public health department 70% of the stock that we've paid for. I'm not sure that will happen, but that's what I've asked for.
Christine, I think one thing you need to be aware of is that private offices, primary care offices, also have the VFC vaccine.
I'm very aware of that. But that
And
vaccine that was
so-
delivered to them was for the health department.
Actually, but the vaccine coordinator ought to be able to differentiate between what's health department and what was clinic,
Correct.
between those two. So I think the vaccine coordinator will be the really go-to person, because they should have an inventory on what they shipped and to whom they shipped it to.
Everything that's been shipped to the clinic has been VFC for the health department, for the public health department's
And if that's what
use.
their records show, then that's what we should receive.
That's what I've indicated that I expect.
No, I'm just saying, it sounds like from the part of the clinic, they may have not separated that supply.
Right.
And so it should all come to us if that's the way if it was all designated for the health department.
It is my understanding that the clinic did not have a separate VFC program. The VFC, the Vaccine for Children program, was the health department's program, not for the clinic. So now they have to have,
They will need to create their own.
yes, yeah, and I believe Kim has moved forward with all of that.
But that's moving forward.
Yes, and that's on them.
Yeah.
The private stock, once we get our private stock, I'll work with VaxCare, and what they do is they purchase that vaccine from us, and it then becomes their vaccine. It never moves out of there, but it becomes their vaccine, and we get paid for every shot that we give out of their vaccines. But they'll come in and they'll inventory what we have and cut us a check for that vaccine. We do have our Helmer vaccine storage units, 2 beautiful refrigerators. I should take my phone back there and show you guys on a little video tour of how beautiful these vaccine storage units are. So we have 2 refrigerators. One will be strictly for the VFC program, and one will be strictly for private stock vaccine. And then we have 1 freezer, and that's compliant with the VFC program, that I can store the frozen stuff in the same unit as long as they're clearly marked which is VFC and which is VaxCare's or the private stock vaccine.
And this, Dr. Wright, the generators operating and
No,
in place?
no.
It looks like the pad was poured and it's ready to be set. It's just,
I'm kind of out of the loop on that. I was told it was going to be set the 14th, but that day came and went, and the pad is poured, so that we'd had to have some concrete work done, and it's ready. I just don't know where that generator is or who is going to set it, but until I actually put the vaccine in that refrigerator, I'm still okay not having them. But we're monitoring the temperatures. We have our data loggers in them. But as soon as I put vaccine in there, I can't put vaccine in there until the generator is set, in accordance with the CDC guidelines. So they did run us some extra electrical plug-ins back there. I didn't put them in the garage. We cleaned out some space in the HIV area, so we are kind of jammed up back there, but I thought they were safer inside the building than just being in the garage.
Any more questions on the vaccine? Okay, the SEP.
That was renewed at the May 6th commissioner meeting. It was unanimously approved for us to continue until the sunset law, which is July of 2021. After that, we're gonna have to go back, so we didn't get the 2 years, but they really legally couldn't since it sunsets in 21. But we'll go back and ask for approval again in next year. But it was approved. We did have some conversations with the prosecutor. He has some concerns, and I absolutely understand his lens that he looks at this problem. I don't think we'll ever get support from the prosecutor for the program. I just am hoping that he'll let us quietly exist, because it definitely is a needed program in this community. We will be having a meeting with the sheriff and the chief of police, because we would like to start going out into the community and being the agency that picks up any needles that are found in the community. That we feel like our SEP staff should be the ones, they're trained on how to handle needles. We purchased Kevlar gloves for them, so we'll gladly respond to any complaints about the needles in the community, should there be any.
Okay, are we
Christine, this is John Eagleman. I have a question.
Yes, John?
Do we have any way of keeping statistics on how many of the people who come in for the exchange program, how many of those people actually go into one of the rehab programs? Do we have any kind of way of keeping track of that?
With some of the tracking laws that we can't track people, we have a hard time being able to say how many went into it. I can get you the numbers for how many referrals we make for people to go into treatment every year. I'd be happy to provide that to you.
Yeah, but that doesn't that tells us how many we referred, but we don't know how many actually went.
Correct.
Okay, that's too bad.
It is.
Thank you.
Hmm?
Any more questions on SEP?
Okay.
I think the big item is the clinic build-out.
Yeah, so we've met with the architects and seen the final plans for the clinic, picked out what countertops and things like that with them. We were to have everything to them by the end of the week, which I've done already. There was some changes that I did request for due to COVID kind of response. I figured we should have the reception area should be glassed in, so I asked for that to happen. I also asked that since we were doing that, to glass in the counter on the environmental side as well, so we don't have to have temporary things put up. We'll just permanently put up glass there for us to work with the public. We do have to put 2 new doors into the building due to some fire code regulations. The building wasn't up to code, so we have to actually add 2 doors, and they'll be on the north side of the building, one on the west side, and then one farther or closer to the east side. The exit that's in my office cannot be considered fire exit, because you can't enter into someone's office as a fire, so they have to add another door, which is okay with me, because I asked for them to be glass doors, because that whole end of the building is just dark. There's no light on that end, so they are going to put glass doors, so we'll get a little bit of natural light. So we've got all of our stuff in. We should be able to proceed on schedule to put it out to bid relatively quickly. The only thing that's going to hold it up, I believe, is the state and their approval with this. I have heard that they're kind of jammed up, as everyone is with this COVID. So we may be, again, pushed back on when the clinic will actually be done. I don't know that Ken will be able to keep his promise of July 1 to have the clinic done. I'm still saying by the end of summer we'll have a clinic. And in the meantime, we're going to operate out of this room. I'll set up 2 clinic rooms in here with, the foldable curtains to go in between the 2 clinics. So just as soon as we're ready to be up and running doing vaccines, we'll do them in here.
This is Dr. Ryder again. I think it's important to note that the plan that we and I guess the commissioners agreed upon is one that makes the building compliant for future changes. So it was the one that gave us really the most options
Yes.
for future changes in operation.
Yeah, I was happy.
Am I correct in understanding that public health will be totally out of the prior health center building by June 1?
Yes.
Good.
Well, Ron, what do you mean by that?
Well, I mean, there will be no areas of the building that will be occupied by public health.
Yeah, I mean, the only thing that I have is, they whatever vaccines they're given right now, and then they do case management, but all of that comes to me on June 1. They've been doing still continued case management with TB, which I checked with the state. We only have 2 TB cases last year, so that's not a lot. And so
My concern is not so much the function remaining as the actual physical presence of public health employees no longer being in the building. Is that accurate?
all of my employees are out.
Okay, so the point being, because we want to be able to lease the full square footage, less common areas of that building to WellCare as of June 1.
Yeah.
County.
Yeah, and I think we've got all the equipment that they're gonna give to us, other than the vaccine. I don't think that I'm gonna get the other stuff that we requested and said that we would get. I've yet to see it materialize here. There was some cholesterol machines and some other things that we had requested. They haven't materialized, and Eric hasn't called me to tell me to come and pick them up. So I'm not interested in scrapping with anyone over this stuff. So if someone else wants to take that up.
Do you have possession of the van?
I'm sorry?
Do you have possession of the van?
No.
Christine, this is John Eagleman.
Yeah.
I have a question.
Yeah.
With all of the rain we've had the last week or so, was there any evidence in our new building anywhere of roof leak?
No. Nope, we haven't seen anything. I haven't went up into the attic part of it, but I could probably send one of the guys up there. I don't know if you guys know, I broke my ankle last week, so. But there's a couple of access points. I could send someone to look. I'm not gonna have them crawl around up there, but they could look and make sure that there's no leaks up in the places that we can't see, but I haven't seen anything visible.
Okay, good.
But yeah, I'll ask Jason Howard to do that. Just, poke his head up there and take a quick look around and see if he sees anything. That's a good idea, thank you.
Okay, any other questions on the clinic build out? Okay, you have nothing listed under old business. Christine, do you have anything under old business?
I don't believe so.
The new business, you've already mentioned that you're planning to meet with law enforcement to discuss the SEP issues. I'd like to be at that meeting, so
Okay.
please let me know when that's going to be.
I'm hoping it's early next week, and it'll be a Zoom meeting, so I will definitely get you an invite to that. The only other thing that I would have would be, which ordinance would you like me to work on next? We have the food ordinance and a septic ordinance that I think are probably equal in importance. If I had my druthers on asking which one I would favor, would be probably the food ordinance. I would prefer to move faster on that one. And, we'll tackle the septic one after that, cause it's gonna be a little more complicated with the septic program.
Okay, so, you'd like board direction on which one to move forward?
Yeah, just, I don't know that you need to vote on it, just give me some direction on which one you'd like me to see worked on.
Unless somebody objects, I think we would defer to your preference, which is to do the food ordinance first. Do I hear any objection to that?
Seems reasonable to me.
Okay,
So we'll move ahead on the food ordinance.
I will do that.
Any other new business? I think the timing of our meetings, I don't know that we need one in 2 weeks if there's any burning issues, but certainly at this point, we've kind of returned to our meeting on the third Thursday of the month. So I would suggest, unless there's objection to our next meeting being the third Thursday of June.
June 18th?
at noon. And that date is, I don't have my calendar in front of me,
18th.
The 18th.
18th. Is that a problem for anyone? Is there a motion to adjourn?
Peter, so moved.
Peter Zaleski has moved. Is there a second?
Second.
Jeff Butler seconded it. And unless there's an objection, I think we won't do a roll call vote.
Very good. Thank you.
So when is the next meeting?
June 18th at noon.
Got it, thank you.
We'll send out I'm assuming we'll still continue to have the Zoom meetings until, later.
Okay.
Yes.
Okay. All right. Thank you.
Thank you.